Kids are headed outside to play. You're probably giving them some constant reminders. Put on that sunscreen.
Yeah, and you may feel like a broken record, but one Kansas City University doctor says the nagging, it's necessary. So we want to welcome in Dr. Kelly Reed this morning. Good morning.
Hi, good morning. Thanks for having me.
Awesome to have you here. So first, let's start off. Dr. Reed, what age should children start wearing sunscreen?
Well, we should really start protecting them, from birth, but it's recommended age 6 months and older. You can start applying a physical blocker, something containing zinc or titanium. It's okay to apply on the children 6 months or older, but clothing is actually even a better option to keep their whole skin covered.
Okay.
Dr. Reed, let's talk about the types of sunscreen that we should be using for our kids. For example, can kids wear adult sunscreen?
They can wear adult sunscreen that is zinc or titanium containing only. So those are generally the ones recommended for younger kids just because they've been around for a long time. The studies show we don't really absorb a lot of that into our system, so they're considered safe.
Okay.
And Dr. Reed, we know most sunscreens say reapply maybe like every 80 or 90 minutes. Is that correct? Should we reapply more often or?
Yeah, so the reapplication is usually where people kind of forget to do that. So you want to make sure you're reapplying at least every 2 hours. If you're swimming or sweating or doing something where the sunscreen's wearing off, then the 80 minutes or sooner would be ideal.
All right, give us some ideas about what to do to treat a sunburn. What's the best way to get our kids some relief?
Sure. So prevention is going to be the top thing to help relieve a sunburn. But if they do get a sunburn, if it's mild, it's just kind of a little red, no blistering, you can use some cool compresses, cool baths, Tylenol or ibuprofen, depending on your child's age. And then a low over-the-counter steroid like hydrocortisone can be helpful. If it's worse than that, it's blistering, they're having fever, chills, it's more significant, you're going to want to get them to see a doctor because they can have more systemic issues or more problems with that can be dangerous.
What about blisters? What if they don't have a fever, but they have blisters and the skin just looks really red?
Yeah, so you're still going to do the cool compresses, cool baths, Tylenol, all that. The blisters, you want to try to leave those intact because once you open a blister, it's actually open to bacteria and can have infections. So if they have blisters, it's a good idea to see a doctor just to make sure that you're taking care of those appropriately.
Okay.
And as a dermatologist, tell us what are the most important thing you want parents to remember. I just recently was outside at the pool, forgot to put sunscreen on my hands. And I didn't realize that because it's not something you think about. You think about, your body. And my hands got sunburned.
Yeah, so really, any length of time, if you're out there a long time, you can get a sunburn on any part of your body. Parents, we tend to forget our scalps, our nose, the back of our necks, top of our ears. So usually we recommend sun protective clothing is going to be your friend, especially for kids, because it's easier to put that on than try to slather sunscreen everywhere. And then you have fewer areas you have to apply the sunscreen. And additionally, you want to remember that it's really important because, sunburns and sun damage is the leading cause of skin cancer. So even 5 sunburns in your whole lifetime doubles your risk of melanoma.
All right. That's Dr. Kelly Reed from Kansas City University. Thanks so much for the ideas. We appreciate it.
Thank you.
Yeah, thanks so much for having me. You all have a good day.
You too. Thanks.